how has the combination of Navident's navigation and Micron Mapper's photogrammetry made a difference in your practice over the last 8 months?
I'd say that it's certainly made a big difference. I think our full arch protocols have completely changed in a very positive way based on Navident and on the photogrammetry portion or the Micron Mapper portion. We are able to deliver better fitting prostheses in less time with more comfort for the patients. And ultimately, we just feel very strongly that the prostheses, specifically the temporary prostheses that we're delivering on the day of the surgery, are just of so much higher quality than what they used to be. You know, whittling down a denture, or the days of doing that are gone. And this technology allows us to make sure that the implants are in the right spots. But the Micron Mapper has allowed us to really capitalize on our digital protocols in terms of getting patients in and getting them taken care of.
There's static navigation, there's dynamic navigation, and there's doing things freehand. I'm sure you've had experience with all three of those. Can you speak to dynamic navigation versus stackable guides, for instance, regular guides and freehand surgery?
For sure. Most of in our infancy of doing full arch treatment and in our residency training, we use stackable static guides, and there are some significant disadvantages, in my opinion, about surgical guides, stackable guides. The first being the amount of reflection that is required. You know, in the maxilla, you have to get almost around the tuberosity. You really have to it requires a large amount of reflection, which translates into potentially more postoperative discomfort for the patient, more surgical time to be able to just reflect in places where you wouldn't need it otherwise. One of the other significant disadvantages is when you have your foundation guide in, you lose that tactile sensation that a surgeon gets over the course of time with experience. So you can't really feel you can't feel the bone implant interface, whether the bone is soft, whether it's hard, and you're also completely trusting that guide. That static guide, again, if all goes well, it goes well, but you can't see through that foundation guide to see exactly where the implant is, to make sure that it's getting into the right spot. And having that direct visualization, I think, is very powerful. So the dynamic navigation that Navident offers allows both of those problems to be fixed, because your surgical field doesn't have to be any larger than what it is that you need, and you're able to not only see the software and what's happening, but you're also able to see exactly what's happening in the patient. So I think, at least for our practice, and I think for a lot of higher end oral maxillofacial surgery practices, the days of using stackable guides, I think, are past.
Excellent. And how about just freehanding it?
Freehand surgery, I think that there's still a place for freehand surgery. I think that sometimes the dynamic navigation and freehand surgery come together into one, specifically in certain instances. We use, I would say 90% of the time we're using the dynamic navigation, but there are instances where, you have to rely on your, surgical skills to be able to get something done in a case. So I don't think you throw the baby out with the bathwater. If you're not able to use it 100% of the time, it's still usable 98% of the time or 95% of the time. So again, as surgeons, I think that we have some pride as well, and we want to be able to use our training, and this doesn't take that away, but it really just, again, allows additional confidence in the training that you have received to make sure that you're doing things that you want. A large portion of our residency training, our chairman at the University of Louisville, where I trained, his name was Brian Alpert, and he was a pioneer of oral maxillofacial surgery. And he always encouraged us to get post-operative radiographs after we did any sort of facial fractures, dental implants, anything that we were doing, because it's a teaching tool. It's a teaching tool to allow you to see at that point how successful you were at delivering on the surgical plan that you developed. These dynamic navigation platforms, allow you to see that in real time, which is just really an amazing thing. It's amazing technology.
So, from a marketing perspective, how have these two tools helped you differentiate yourself, both to your patients, perhaps, or to your referral network?
Overall, the communities in Southern California, they're very into their overall health. And they come in, with overall pretty good questions. They're somewhat educated about, what dental implants are, and, they've done some baseline education.
Mhm.
I think, again, the technology, having dynamic navigation inside of your practice, specifically if it's marketed correctly to the general public, again, it reinforces their confidence in the team that's treating them. There are a lot of folks that don't do it the right way here. We're very close to, to the border, so there's people that go, down to Tijuana to get treatment done. There's people that stay here in San Diego and get treatment done by people that don't know what they're doing. And when, again, my hope is when a patient steps into my office, we've already educated them and they already feel a level of confidence that they wouldn't feel otherwise. And I think the dynamic navigation and marketing that dynamic navigation is another way to be able to boost a patient's confidence. When it comes to marketing to our referrals or to the general public that, may be sending patients our way, the step is to make sure that they understand the differences between the way that this used to be done, full arch dentistry, where you'd whittle down a denture and drill holes in it, and then it was a 3-hour ordeal, versus where the technology has allowed that to come, where the patient was again kind of just sitting and after the surgery with nobody continuously going in and out of the mouth with impression material and rubber dams and all this stuff. So I think that the marketing strategies that Navident and MicroMapper allow you to have, there's strength in both, and there's power in both, not only to the general public, but also to educating the referral community about how advanced the technology has allowed your protocol to be able to come, why it's better for patients, why it's better for them. And overall, I think, again, that you can have the fanciest stuff in your offices, but you have to be able to get the word out, and marketing is a big part of that. A lot of us don't like to be a salesman, but at the same time, we need to have confidence in being able to relay confidently to people that this is the way that they should be treated. If this is the way that you or your wife or your son or your daughter, if that's the way that you would want them to be treated, then why not tell everybody else that that's the way that they should be treated too.
It's not just the staff and yourself as the doctor, but the patients obviously are the main focus of the technology. What's their reaction been to you implementing these two technologies into your office?
I'd say that from a patient standpoint, they've been very impressed that we go to the lengths that we do. There's already a lot of technology in our office, but this is another piece of technology that just kind of confirms to them that they're in the right place, they're in the right spot. Dentistry and medicine have the confidence in dentistry and medicine has somewhat shrunk over the course of time. And I think that the type of practice that we want to provide is a practice that we would want to be treated in. And I think patients automatically feel that when they see, again, the lengths that we go to ensure that they're having successful outcomes and successful treatment. From a micron mapper standpoint, ultimately patients don't know what they don't know, but most patients hopefully are only going through this one time. The micron mapper allows the prostheses to be delivered quite a bit more efficiently, more quickly, without a practitioner after the surgery going in and out of their mouth for an hour or 2 hours, 2.5 hours. Allowing them to just kind of sit after the surgery is performed, allowing the photogrammetry portion to go into your digital protocol, printing the prosthesis. Really, by the time that they're just coming to, they've got a prosthesis in. There hasn't been somebody beating them up after the surgery, and I think patients would want it done that way every time. I know that I would, but again, sometimes they don't know what they don't know. But going through it this way versus going through it the way that I would say the old-fashioned way, there's a huge difference. And we like talking to patients afterwards because on our night of surgery calls and then our post-operative visits, the patients are saying, I'm doing great. It was very easy. And, you didn't always used to hear that, because not only was there, again, the surgical time, whether it's an hour, 2 hours, 3 hours, but then the dentist would come in, or the prosthodontist would come in and spend another hour, 2 hours, 3 hours. And, their overall treatment times were getting, kind of long, specifically when they were the focal point of that treatment. But after the surgery is complete, really they're just hanging out until the prosthesis is finished and you screw it in and then they go home. So really powerful stuff.
Wonderful. So you're a very successful oral maxillofacial surgeon, practicing for over 10 years with 2 thriving practices in San Diego. A common comment from some of your specialist colleagues is navigation slows me down, or I don't need it. I'm accurate enough as it is. What would you say to that comment?
I would say that, our goal as specialists, specifically as oral and maxillofacial surgeons, should always be delivering the best possible care that is out there. A lot of us have been placing implants freehand for a really long time and getting just fine results, acceptable results. But, our goal should be the best results. It's almost like, if you're flying a plane, and you had an additional radar, you would want to use that radar. You want to be able to use the technology that's in front of you to be able to get those best results. So I think that, can it be done? Otherwise, it can. It just depends upon, what it is that you want and what kind of practice that you want to have, what kind of quality that you want to deliver to patients. And I think that for our practice, for where we are, I think without a doubt, Navident allows us to deliver better care.
Excellent. Dr. Koshgerian, we spoke 5 years ago and you were evaluating our technology. Ultimately, at that time, you decided not to move forward with the purchase. That changed a year ago when you purchased the combination of Navident and Mapper EVO. What exactly facilitated that change?
The thing that really moved the needle for us was the two functions in one. We were long courting a surgical navigation platform, and we were always thinking that Navident was going to be the right option that way, as opposed to some of their competitors. But we were also getting into the digital full arch space, and we were looking for a photogrammetry function. When we reconnected with you, Jason, knowing that the machine was going to do both, it was really a no-brainer for us at that point. So it was great.